Next we have Smisha, I'm sorry, I should have got your name right. Smisha Agarwal. Smisha Agarwal. As an associate faculty member at the Johns Hopkins School of Public Health and currently final year doctoral candidate at UNC Gillings School of Public Health. Dr. Agarwal started her career as a dental surgeon in India before moving on to global public health. She has an MPH degree from Johns Hopkins and an MBA from Hopkins Carey Business School. Dr. Agarwal co-founded Global Health Bridge in 2010, a nonprofit dedicated to using technology to improving healthcare around the world, and served as the CEO until 2013. Since 2012, she's been working with the Hopkins Global mHealth initiative to provide technical support for monitoring and evaluation to a number of mHealth projects focused on maternal and child health. She has helped improve data organizations, collection methods, and utilizations while also promoting better understanding of mobile technology opportunities and challenges among practitioners and the public. As a member of the WHO mHealth Technical Evidence Review Group, a panelist at the World Islamic Economic Forum, and her blog post for the Huffington Post, she has highlighted the significance and the opportunity for mHealth to improve healthcare both domestically and internationally. Dr. Agarwal is part of the World Health Organization Working Group, recently published guidelines for reporting of mHealth interventions. As you may have seen them in the British Medical Journal, we're very lucky here to have her present some of her work. Thank you. Please welcome Dr. Agarwal.
So good morning, everyone, and I'll be talking briefly about the mHealth evidence reporting and assessment, or the mERA checklist that was recently published in the BMJ to support comprehensive and transparent reporting of evidence on digital health interventions. So just a brief background. As many of you know, in the last decade, we've seen a tremendous proliferation of mHealth solutions globally. However, there continues to be limited evidence on their effectiveness, and there have been numerous calls for better evidence and better quality of evidence. So to give you an example, since 2011, there have been over 1,700 publications in mHealth. So in the reviews that I've conducted, I've been very surprised to find a number of articles that show no significant effect of a digital intervention, but conclude very enthusiastically, emphasizing the great potential of mHealth. And this has been the case in many areas. So I'll go through a brief list, and it says a systematic review on the evidence about the effect of technology on increased performance of health workers concluded with very formal few outcome evaluations of mHealth, gamifications of health apps, absence of valid evidence, HIV treatment and prevention review, and concludes with lack of evidence again. Similarly, for non-communicable diseases, support for elderly patients, chronic disease management. So there definitely is a lot of enthusiasm around it, but the evidence does continue to be somewhat limited. So the mERA checklist was developed to address this gap, and it is supposed to help authors improve the reporting of mHealth interventions or digital health interventions. And we expect that improved transparency in reporting will promote critical assessment of the intervention, and also that standardized reporting will help improve the overall quality of evidence. So what the checklist does is provides a minimum set of criteria to define the content, what is the intervention, the context, where is it being implemented, and technical features of how it was implemented. And just to be very clear, it does not aim to support the design or the implementation of the mHealth studies, and it also does not evaluate the quality of the research methods used. Rather, it focuses on the quality of the reporting of the research methods. So there is precedent for similar guidelines that have been published in the past, which many of you may have used. There's Consort for randomized trials, Trend for non-randomized trials, Correct for qualitative research, Stroke for observational studies, Tidier, which was recently published as well, for improving the reporting of interventions, And mERA most closely aligns with Tidier and has in fact been used Tidier to inform much of its way. So a little bit about the development process of mERA. It was the result of 3 years of multi-institutional partnerships led by the WHO MTurk. Duke was also a member. Our colleague here, Lavanya Vasudevan, was part of the MTurk and contributed to the development. It was a highly iterative process, starting with the development of an approach for these guidelines, which was discussed at a 3-day meeting in Geneva. A task was set up to test an initial checklist on peer-reviewed papers and reports across a variety of disciplines. It was then tested and the definitions were refined based on applications by an army of epidemiology students, made sure that the definitions were well understood by a variety of audiences. And then finally, it was applied to 3 health topics across 3 institutions, so across Johns Hopkins, Harvard, and FHI 360 on 3 very different topics. It was management of stockouts, promotion of provider adherence to protocol, and promotion of adolescent sexual and reproductive health. So we consolidated all the mHealth research that's been conducted across these 3 areas and tested whether the checklist works well for them. It was recently endorsed by the WHO to promote standardized reporting of mHealth interventions. I'll go very briefly into an overview of the checklist. So it comprises of, the core mERA checklist comprises of 16 items. These items are focused on comprehensive reporting of the mHealth intervention. In addition to the core mERA checklist, there is also a methodology checklist, which focuses on reporting of the study design and methods. It comprises of 29 items. We recommend that the mERA core checklist, the 16-item checklist, is used in conjunction with a study design appropriate checklist like Trend or Consort. However, we also recognize that the state of where the field is in LMICs, it is attracting a lot of innovators that are completely unfamiliar with the terrain of publishing or with scientific methodologies, and therefore we propose the methodology checklist, which is study design agnostic and can be used if the author is not able to use any other study design checklists. I'll go very briefly through the 16 items that comprise mERA. And so it talks about infrastructure as a checklist item, the availability of infrastructure, technology platform, and so the manuscript you'll see will provide justification for why we consider these important, but I'm not going into them right now in the interest of time. But details about the technology platform, interoperability or the health information systems context, how was the intervention delivered, if it was, what was the mode of communication, SMS, IVR, what was the content and what was the source of the content, usability and content testing if it was conducted, and what was the user feedback based on the usability and content testing. Access of individual participants or any kind of structural, economic, social barriers to access. A basic assessment of costs, which continues to be a big determinant of scaling up such interventions. Adoption inputs or any kind of training inputs that were made to ensure that the intervention is adopted. Considerations for limitations or limitations for delivery at scale. Contextual adaptation to maybe a different language or different context. Replicability, and we recommend sourcing screenshots, flowcharts of any algorithms that were used, and so on. Data security issues, of course. Compliance with national guidelines or regulatory statutes. And last, any assessment of the fidelity of the intervention implementation. So that was just a very quick overview of the 16 items. And So you can find the guidelines on BMJ, and it's also hosted on the Equator Network, which holds all the library of standards for evidence reporting. This is very much a living document. We expect that it will evolve as the field evolves, and so my purpose for being here was to help dissemination and hopefully encourage you to use it. But we welcome everyone's feedback. Thank you.